Hi guys, my name is Llewellyn Roca, and I'm here to give you guys my speech about nursing, but I'm actually 21 years old and a nursing student here at Liberty University. So imagine yourself responsible for monitoring the lives of 8 to 10 people, some in critical condition and others are stable, but you were just yelled at by a man who thinks you're stupid because their wife isn't getting better. But that man doesn't even have a high school diploma. And in the room next to that, there's a whole family grieving because the oldest son is in a coma due to a motorcycle accident. Environment is what nurses experience on a regular basis. As Christians, it is important for us all to live our lives in a way that embodies the values of the Lord. But sometimes we don't really know how to do so. But a good way to learn is to listen and to be informed with how Christians live. In this case, I'll be informing you guys on the life of a Christ centered nurse. But I'm going to be focusing on Galatians 5:22 to 23. And it says, "But the fruit of the Spirit is love, joy, peace, forbearance, kindness, goodness, faithfulness, gentleness, and self control." A registered nurse is on a platform that will contain several challenges. And the only way that a nurse will be able to easily overcome these challenges is with the fruits of the Spirit, specifically gentleness and self control. Obviously, I can't see what you guys are thinking, but I'm hoping that you guys are thinking of a time when you interacted with the nurse or when you saw someone interact with the nurse. And with that thought in your guys' mind, I would like to continue the rest of my speech. To begin, nurses are responsible for the safety and health of several patients, but they're also required to communicate with a great deal of people with vital information. And to effectively do this is no easy task. Gentleness is required to make it possible. In the article Nursing and Patient Safety from the Patient Safety Network, it says that nurses are a constant bedside presence and they are required to speak to physicians, family members, pharmacists, and other medical personnel on a regular basis. In this article, you can see that nurses speak to several different people. The information being discussed is about the health of the patient, and it's vital for the information to be communicated clearly. Um, and when the information is being given to the family member of the patient or to the actual patient, gentleness is needed to provide clear information. It can be implied that gentleness is needed when speaking to the family and that a family member and patient because they are usually very emotionally distraught due to the circumstances. And another example can be found in the article What Nurses Do, which says that nurses provide health promotion, counseling, and education. And this role nurses play is very simple, but it's very important and effective. We all know that no one is happy to be in a hospital and that sometimes you have to be counseled to get through it, to get through the hard time. And we all know that gentleness is required to counsel someone. But when a nurse has to educate a patient on a simple procedure, like how to apply medication or how to apply a simple ace bandage to a wound, gentleness is needed so that they can understand it clearly and that they can so that the patient can do what's necessary to heal. There is no doubt that nurses do a lot of communicating with other people, and to make sure that the communication is effective, gentleness is needed. Nurses are in the heart of a very stressful work environment, yet the only way that they're able to cope with this stress and to be an operative nurse is with self-control. An example of what causes stress for a nurse can be found in the article Nursing and Patient Safety from the Patient Safety Network website, which says that nurses are frequently exposed to disruptive or inappropriate and unprofessional behavior by physicians and other healthcare personnel. This statement explains how the interactions nurses have to encounter can cause stress, But if the nurse has self-control, she won't let these unprofessional interactions affect her, and she'll continue to work effectively. Another example can be found in Bonnie M. Jennings' article, um, Role of the Work Environment and Working Conditions, which says personality traits also influence the stress equation. Some things might overwhelm people, and some things might be exhilarating for others. So this supports my claim that if a nurse who's embodied self-control part of her personality, she'll be able to easily over she'll be able to control herself and not let these stressful things really affect her, and she'll be able to continue to work as a very efficient nurse. It should be obvious to you guys now that nurses do experience a lot of stress in their workplace, and it isn't always from the patients that making it difficult. The only way that these nurses are going to be able to stay composed and to work well is with self-control. In conclusion, I've spoken to you guys and given you guys insight on what a nurse confronts on a regular basis. Um, nurses are required to nurses are required to discuss with several people very important information about the patient and their health, and the only way they're able to do this is with gentleness. Nurses are also immersed into a very stressful work environment, and the only way that they're able to stay composed is with self-control. You should now be able to see that a nurse who embodies the Christian values that are present in Galatians 5:22 to 23 will be successful at their trade and will please the Lord at the same time. Thank you.